these individuals, this is what it's like for them every single day. And so, I always say, I can be uncomfortable responding to this disaster for a few weeks or a few months because I'm blessed to come home to my home. But that is the reality for them.
Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. Thanks for being here. I'm incredibly excited today to have Dr. Jamla Rizek with us. Jamla is a nurse. She actually has a bachelor's, master's, and doctorate in nursing. She's done some of her training in New York and in Phoenix, Arizona, and then did a fellowship in disaster medicine at Harvard through the Beth Israel system in Boston. Jamla, I am incredibly honored to have you on the show today.
The honor is all mine. Thank you for the opportunity to share this story.
So yeah, let's get into the story. I want to talk about disaster medicine, and I would love to hear the story that you want to share with our audience today.
I really want to focus on a story that impacted me, and it is the man who did not want to be helped. And this is in response to a hurricane that had the opportunity to go and provide care to individuals. And we call him the man that didn't want to be helped because he was an individual that was very grumpy. He was an amputee. He was very frustrated because he was in this gymnasium with a lot of other people. He was uncomfortable. He didn't have his medications the way that he wanted them. He didn't have the space to move around in his wheelchair. Come to find out that this individual had animals at home. He was used to his own way of doing things. He also was a veteran. And so we have law enforcement that goes around the building, making sure that everyone is safe and just routinely doing rounds. And on one of their rounds, they had a canine with them. And the look on this man's face when he saw the dog was just night and day different. He opened up. He was so excited. I actually talk more about him in my book, but this man had the opportunity to get into his wheelchair and go outside and actually see the dog. And it was then that he kind of lightened up and we were more receptive to what his needs were. And the problem is a lot of times during disasters, everybody has a need and we are so rushed, just like in emergency medicine, that we hear them, but are we really listening to what their needs are? And unfortunately, he was so grumpy that a lot of people kind of just dismissed him. And it wasn't until that interaction with that animal that we were able to see that really it was something as simple as seeing what he missed at home. And that is unfortunately one of the labels that we put on individuals. They're just difficult. They're just grumpy. They're frustrating the medical team. But really, all we had to do was listen to him. It also just highlights the importance of animals in regard to patient care, whether for our veterans or individuals that use them as service animals.
So I'm imagining in this scenario, in this disaster, there's a hurricane. Could you take me a little bit through the scene a bit? Because I'm imagining there are people who are coming from all walks of life that are now grouped together. You had said you were in a gymnasium or some sort of public space to be safe and to help support. That must be a difficult dynamic as well, with all these people coming who are under significant amount of stress. They've maybe lost their home or things are unknown that's happening to their home environment. Can you take us through a little bit of what that's like?
One of the things that I did not mention was that these individuals that were at this particular gymnasium were individuals that were the first that were going to be impacted by the storm. So they were told that they had to evacuate. And a lot of times when people don't have choices or are told they have to do something, that autonomy kind of gets away from them. And unfortunately, that's what happened here. So the individuals that were in this gymnasium were families with kids. They were elderly individuals that had a lot of comorbidities or a lot of health issues that could manage at home alone, but now in this new environment, they needed a little bit more care. There was cots lined up everywhere, and that's where people were, what they were sleeping on. We are blessed as disaster responders to provide the care and then go back home into our comfortable environments. But unfortunately for these individuals, we don't know what that environment was going to look like after the hurricane had hit. And so here they were, they didn't get a chance to bring what they wanted with them. A lot of them could only bring their bag, and it didn't have, the necessary items that make them comfortable. A lot of the kids that were there, had their backpack of toys, but what
Mm.
happens when those toys get old or they're tired of it and there's nothing else to keep them occupied? And a lot of these individuals also had animals or, pets that would come and visit them or other resources. And we've literally taken all of that away from them because we've moved them from that environment that they're used to, that they're comfortable with. So we told them they had to evacuate. They're in a gymnasium with a lot of individuals, a lot of auditory issues as well. So sleeping isn't really the best on those cots either. So we've literally tried to do good, but we've made them more uncomfortable, unfortunately. I would be stressed. We all are as responders, but I can't imagine for somebody who doesn't even know what their home is going to look like when they leave.
And I can imagine as well, he had some issues with mobility. He's an amputee.
Absolutely.
Um, and again, I've never been in a wheelchair before, but if you're in a wheelchair and you have limited mobility and on top of it, you're in a strange environment, that must have been a very stressful situation.
Especially because it was narrow, because we tried to have as many cots available as we possibly could to accommodate as many individuals. And so there are special needs shelters, and those are places that really have more space. They're adaptable for individuals who have wheelchairs or service animals. But unfortunately, this was in preparation for that hurricane. So we were as proactive as we possibly could be. And our goal was just to evacuate individuals, just to get them safe. And this was not a place for somebody who had mobility issues, not at all.
So tell me a little bit. Let's take a step back. You are incredibly accomplished. You've gone through a lot of education, almost the maximum you can get in terms of degrees as a nurse. And by the way, as a pediatric ER physician, nurses have completely shaped my career. And we work very closely with nurses, and every day I learn from them, and they teach me things. And we're fortunate that the nursing profession has continued to grow and develop over time. So tell me a little bit about what inspired you to become involved in disaster medicine. What does that really mean, and what inspired you to pursue dealing with these kind of situations, which are very unpredictable?
My family were immigrants to the United States. And so I had the opportunity to really see what inequities looked like. I remember going back over to the Middle East and seeing how, the closest clinic was literally just a couple doors down, and it was a physician who was working out of a room in his house. And it wasn't anything like a clinic that you would hear stateside or in communities that are perhaps more affluent. And so, his treatment would be, I know you need an x-ray, but I know there isn't one around that you can get an x-ray. There's not a place for that. And that really kind of stuck in my mind how privileged I was here. But still here in the United States, there are so many pockets of places where individuals don't have access to care. And so for me, I have truly been humbled to recognize the opportunity that I have to be in places and in spaces that may make me uncomfortable for a little bit, but really I'm providing a care and a service to individuals that, that level of comfort is all they have. And so it puts it in perspective for me. And I truly am a God-fearing woman, and I truly believe that I need to give back to communities. And I think
Mm.
that the more that I am able to do that, the better I feel, because I know that I can't help everybody, but there are so many places and so many people that don't have access to care. And just by listening or sharing a story, you don't understand how much of an impact that has on someone. And that is why I have chosen to dedicate my life thus far, and God willing, the rest of my life, as best as I can, to individuals who don't have access to care, individuals who are marginalized, and really individuals that, normal for them is, catastrophic for some of us that are so privileged.
Yeah, well, there are two areas of the world that I haven't been. I've traveled extensively to Central and South America, and we shared before I was in Kosovo after the war and Eastern Europe. I actually did a stint as well in Romania after the Iron Curtain fell down. But I want to talk a little bit about the Middle East because as of the taping today, there's a regional conflict happening with Iran and Israel and the US, and now it's involving a number of countries in the Middle East. Have you been, have you had an opportunity to go back to the Middle East and be involved in any kind of disaster relief in that part of the world?
My family is from Palestine. I have not been able to go back due to political reasons, unfortunately. And I say this because there are so many other ways that, as much as I would love to go back, I know that I am not allowed to be back. So there are other ways that I am still able to support individuals from throughout the Middle East, regardless of their background. And one of the ways that I do that is really by partnering with a lot of the NGOs or the non-governmental organizations that do go provide care. So as much as I would love to be there to support those children, I'm certified in pediatrics. I love the pediatric population. There's a lot of intergenerational trauma. I would love to be there hands-on. I know that that is unfortunately a limit. And so we do provide other services, whether it's education, whether it's preparing the responders. What's happening in the Middle East and in other parts where there's conflict is unlike any other conflict. And we're seeing that, unfortunately. And I say that because our most vulnerable are the ones that are being targeted. And so when we talk about pediatric patients, whether it is, vicarious trauma, whether it is direct or indirect, whether we take care of them right now or 10 years down the road when they come to your emergency department, sir, they are going to be at a different level of needing care that we are just not prepared for. And so no, I have not had the opportunity to go back there, unfortunately, but I am preparing myself and other responders for what does that mental health care look like for these individuals 2, 3, 4 years down the road.
You had mentioned a term that I would love to just talk about just for a little bit because it's something that I did not learn about when I was in medical school that I had a chance to witness when I was in Kosovo, which is the concept of generational trauma. Can you talk a little bit about that and what that means to you? And again, I just want to say just from the onset that I am very sorry about what's going on and with the Palestinian people. I see the world through different lenses, and as a pediatrician, I oftentimes see the world through the eyes of children. And whether it's anywhere in the Middle East or anywhere in the world where children are suffering because they are a vulnerable population. And if we don't pay special attention to children and the elderly, there are different and folks with mental health issues, but children in particular are vulnerable and sometimes considered secondhand citizens. And my heart has moved and has been heavy for seeing what's happening to children in the Palestinian territories. But I would love to hear a little bit, and I've heard the word generational trauma specifically around the Palestinian people and some of the generational trauma that they've experienced. Can you talk a little bit about what that means to you and how do you address that as a nurse in your role?
I'll share a personal story, David. So, generational trauma that I have experienced is, my father, God bless him, never finished even middle school. His school was bombed during the Six-Day War, and he had his family to help support. And so I always joke that I got my street smarts from my father. And my mom's family had the opportunity to evacuate to Jordan. And my mom was a teacher in Jordan. And so I joke that I got my book smarts from my mom. But then what happened is when they were finally able to immigrate here to the United States, my father not having a degree, had to do whatever work he could to support his family. And then my mother, though she had a master's in education and taught overseas, that doesn't translate here to the United States. And unfortunately, she didn't teach here. So when we talk about generational trauma, for me personally, I think of the struggles that my family had and how that, got instilled in me, the values. So for example, we didn't have access to certain things. Going to the doctor wasn't an option. We didn't have access to cell phones or to computers. And so
In the
going to,
US, in the US, after you came
yes,
here.
sir. Yeah, I was actually born in the States. So my family, when they immigrated here, when they finally became citizens, then they had children. And, I didn't grow up with all the bells and whistles that everyone else did. I was a young adult, a teenager, but I was really an adult. And so we see this a lot when we talk about generational trauma, where you have 5, 6, 7 year olds even that are literally young adults. They can help balance a checkbook or write a check. They are translating for their family. They are understanding things that, kids should not understand or need to understand. And so when we talk about generational trauma, not only is it the lived experiences that I've had, but the stories that my family has shared with me that I will pass down to my children. And we need to pay more attention to generational trauma because if we don't, we're never going to be able to break that cycle. And there is this misnomer that children do not have PTSD. That is a myth. Kids do suffer from PTSD. They just don't show it in the ways that perhaps we're used to seeing in adults. I would also argue that in South America, some of the kids that have come across the border, their journey, and I have been blessed to hear and care for some of those children, their journey of what they went through to get stateside is so impactful. I can't imagine, a 6, 7, 8 year old doing that alone with just a group of kids. And so that is that generational trauma that we talk about and how they will pass that on to their children one day, the struggles that they have had. And I wish that more people, especially in regard to the pediatric population, kind of invested more into this because it is going to be a game changer for the future generations of how we adapt to providing care for them, especially in regard to mental health resources that are culturally appropriate, but then also age appropriate as well.
I really appreciate that. The um, there was a famous saying, and I forgot who said it, but societies are judged historically on how societies manage vulnerable populations, and how children are treated, how the elderly are treated, how folks with mental health are treated. And I really don't want to go deep into any kind of political stuff, but I wonder how this period of time in our country's history will be remembered based upon how we are dealing with vulnerable populations in the current state. It worries me, and I just share that just out of the lens of children, because that's what I do. And I work with vulnerable populations as a pediatric ER physician. I deal with kids with mental health emergencies. We're dealing with the community, and I live in Arkansas, which is one of the poorest health states in the U.S. on almost every single level. And I worry, and we're all hearing stories about current immigration policy, and I wonder if it's creating more generational trauma than actually solving it. Do you have any thoughts on that?
Yeah, and maintaining, neutrality and being apolitical, I would argue your point 100% that children are the ones that are going to experience so much of these inequities. And I too am worried as a clinician that the lack of access to care for some of those children now is going to impact them for their life. This is known. Gaza just has the highest rate of pediatric amputees, and so I would argue that we think we are doing a service by supporting them and getting limbs, right? But what we don't understand is that great, they have a limb today, but then in a couple years, when that limb needs to get adjusted, and they don't have access to leave, or there isn't finances or anything to help them get a new limb, a new prosthetic, did we really do any good in the beginning by giving them a limb? And I think that this is one of the most challenging things that we're seeing right now, especially as it pertains to not even being able to evacuate to neighboring countries, or having to make the decision that if you leave with your child who needs medical care to this country, you have to leave the rest of your family behind, not knowing if they are going to be alive when you come back. And so these are some of those ethical dilemmas in regard to disaster response that, are in the back of our minds. But as it pertains to kids, I don't even think we can fathom everything that's happening. I only relate to the pediatric amputees and their lack of access, especially as it pertains to, prosthetics, and where do they go? And then who's going to do that long term for them, especially if there are challenges where you can't cross borders.
Well, I hope I don't get too emotional, but I want to share. Usually it's you telling a story, but I do want to bring this up because I went to Kosovo in 1999, and I volunteered to spend a few months during a sabbatical year, and it relates to generational trauma. So I just want to share with you, and maybe we could talk about this for a few minutes. But I was assigned a driver. So for those of you that don't know, Kosovo was part of a bigger country pre-fall of the Iron Curtain called Yugoslavia, which was essentially an amalgamation of a number of different countries. Kosovo is an area that was part of Yugoslavia that was 90% Muslim and 10% Christian. And the Muslims were, many of them were related to the Albanian population, which is mostly Muslim. And then there was a Serbian minority in Kosovo that essentially they were running the show there for a while. And then Kosovo was really about independence for the country, and also for some recognition of equality for all peoples, because the Muslim population was subjugated and discriminated against by the Christian population. By the way, some of this, and I didn't go deep into the history, is related to historical contexts that are hundreds, if not thousands of years old, dealing with migration of peoples and whatnot. But my driver took me to, he was Muslim, and this was after the war, and he took me to his hometown, and the entire town, it's a small little village, was razed. It was burnt to the ground. There were a few homes that were still completely intact. And so he took me to his home, which was razed. And he said I was born in this would have been room. It was sort of marked out. And we walked on the ground, and he was telling me about his family. So I said to him, your home was razed and the home next to you was not. I said, what happened? He said, well, it's an interesting story. It was during the war. And we were a multi-generational, and the town was very multi-generational. In other words, multiple story little homes, and grandparents and parents and children would all live in the same home. And his home was Muslim, and the home next to his was Christian. And they all got along for decades and decades. And in fact, his best friend lived next door. So in the middle of the night, one night, there was a knock on the door. He opened up the door, and his friend and a group of people were there with torches. And they said, "You have 5 minutes to get out of the house. We're burning your house down. Take what you need." And so they did what they had to do. They left the house, and it was burned down to the ground. And I grew up in the New York area in the late 60s, early 70s, and I was in a heterogeneous environment where I was with people from multiple immigrants from multiple different areas of the world, and never truly felt discriminated against myself growing up. And the weight of that, just sitting there with him in standing where his home used to be, and thinking that there was generational anger, or I don't even know how to even describe it in words. And this home that had been in his family for generations is now burnt to the ground. And it really moved me and made me have a deeper understanding of what it is like to be in an area of where there's war, where humans are fighting other humans, and frankly, after a few months of being there, I just felt very sad that there are human beings living under those circumstances, and made me feel very fortunate that I'm living in a country, and I grew up in a country where I didn't have to be exposed to that on a moment-to-moment, day-to-day basis, and fearing for my life. So, any thoughts about that as a disaster? Now I told a story.
It's a excuse me, it's a beautiful story about something you said really stuck with me. And these individuals, this is what it's like for them every single day. And so, I always say, I can be uncomfortable responding to this disaster for a few weeks or a few months because I'm blessed to come home to my home. But that is the reality for them. I may not have a shower for 3, 4 days. I may not have hot water for 3, 4 days, but when I go home, I can, and I'm so ignorant, I will waste as much hot water as I want to kind of forget and wash away everything that happened. But that's normal for them. And it is very hard unless you have been impacted or you have lived through that to truly understand what these individuals go through. And I would also argue that that is another form of trauma that is indirect because you are experiencing the trauma that he had. But what's beautiful is that these individuals still have that passion, that resiliency to keep going. Not everybody does. I will be completely vulnerable and say that I have truly struggled. I have lost family. I can't put into words what it's like. And so when my friends or my colleagues will see me laughing and smiling, they think something is wrong with me, but really it is better than being sad all the time. And I just have to understand that there's a different purpose for me right now. I could have been there. I could have not even been alive anymore, but clearly I'm still here for a reason, whatever that reason is. And I just have to keep doing what I'm doing. And so, in my mind, when I hear that story that you shared, or I hear other stories, or I live through some of the experiences that I have from responding to disasters, I have to remind myself that them just seeing a different face, somebody who is smiling and energetic and happy, even though they are miserable and everything has been destroyed, that little bit of hope is really what they cling on to, that happy face. I have a colleague who goes all over as a clown. He's a nurse, but he goes and he's been to Gaza and he's been to Tanzania. And he always, kind of, he wears that clown costume and he puts the nose on. And the kids that are in these camps, they just cling to him. So there's bombs and there's destruction all around. It's very surreal. But in this little camp, this little tent, the kids are all laughing, completely oblivious to what's happening around them. And that is why we do what we do, because those kids need something to hold on to.
It's a beautiful story. And I'll tell you, when I was there working for a non-governmental organization called IMC and International Medical Corps. The focus of that organization was less direct care, and it was more about rebuilding and teaching and working with other colleagues. And one of the most beautiful things that I experienced was connecting with other physicians who clearly had a mission and a resilience to make their situation better. And that kind of courage really inspired me to, continue to do the work that I do every day in the morning, which is get up and helping take care of kids in a vulnerable environment. So
I think I think having that drive every day is what literally is going to help us help the future generations, because the world needs more people who have that passion. And when we lose that passion, then what happens to our future generations? What's going to be left for them?
it's a really good point. So right now, I get a sense that you, with your expertise in nursing and in disaster medicine, are you primarily teaching? Do you actually go to disaster zones now? What is your primary focus?
I do currently do a lot of teaching. I do have a platform where I, give CE courses on Adventures with Nurse Jamla, and it's really in regard to what nurses need to know about providing disaster care. I current clinical environment, I still provide care in the emergency department, but with the political stance the way that things are now, I am very limited because of how I look. And so I say that completely being apolitical, but just it's a fact that I am not able to go and provide care in places because of my background, even though I am a
I'm
US
sorry.
citizen.
I am very sorry that you're experiencing that. That really hurts my heart.
So the only thing that I can do, because I cannot be hands-on, is support people who want to go.
Mm.
And what I do is I help support them by providing just-in-time training. There are a lot of individuals who are going to the Middle East and in other countries. And I am blessed to be able to meet with them and really provide a bird's eye view of what it's like, because it is, as I mentioned, unlike anything they will ever see. And I highlight what it's like for them. Just like that experience with your driver in Kosovo, despite what happened to his home, that hospitality that was there, that is something that these individuals that respond to other countries always say they will never forget. And that's something that always sticks with me. So I am fortunate that though I cannot be there directly, indirectly, there are people that have a little piece of me in them as they go. And that is the best that I can do now, unfortunately.
Well, tell me a little bit about that. Tell me about just-in-time training and tell me what is your approach to that kind of preparation? Because, uh, I've been to some disaster areas. I've been to the Amazon. I've been to some areas that are pretty rudimentary, and sometimes it's hard to completely uh, prepare until you actually are there. Uh, and there are sometimes some things that I'll just give a quick anecdote. When I went to the Amazon, I went with my mentor, who was an older gentleman named Dr. Enrique Trapp, and um, um, he's been a life mentor for me. And he and I went to the Amazon, and I had this idea that I was going to wear, long sleeve shirt, long sleeve pants, mosquito netting with a hat, multiple layers. And Enrique said, it's not going to last. I said, no, I'm going to be really good about protecting myself against malaria and the mosquitoes. We were on a boat for about 30 minutes, not doing
We're
anything,
good.
just sitting on the boat. And I was in the Amazon because it was so hot. It was 100 degrees out. So that preparation did not go very well. So I had pants and long sleeve shirts, never wore those. And because the environment wasn't right for that. So I would love to hear more about just-in-time training and how do you prepare someone to go into a disaster zone?
I think one of the things that is so important is that we are used to Western medicine. And so when you think that as a pediatrician, as an emergency pediatric physician, that you are going to go and work in an emergency department as you have in Arkansas, despite the fact that there's a lot of inequities, as you mentioned in Arkansas, think of that as the creme de la creme compared to what you're going to see. And I say that because we have a lot of providers that, want to go and help, and they have 8, 10, 12 suitcases of supplies that they want to bring with them to be able to perform surgeries or, simple procedures on the eyes or even cleft lip repair. But then they don't realize that, all that equipment gets taken from them, and now all they have is their hands, and they don't always have gloves, and they don't even have the basics. And so when we prepare people for just-in-time training, when we prepare people, we have to prepare them to figure out what are you going to do with your hands, even if you're a pediatric emergency physician, your skills, what can you hone in on because you don't have, you'll have your stethoscope, but you don't have, a pediatric pharmacist who's going to dose your meds, or you don't have this medication. What's an alternative? And so when we, specifically individuals that are going to the Middle East, some of the other things that we stress is, what is the best that you can do? And so some of the things that we say is, you think you're doing good by providing X, Y, and Z for them, but then what happens when you leave and they don't have that follow-up care? There's stories of, surgeons and physicians that are literally performing surgery without anesthesia. And so that would completely unheard of here in the States. And so we mentally prepare individuals for what that's like. So then are you going to choose to not cut that person's leg, make them an amputee, which is going to save their life because you don't have anesthesia? Or are you going to just, do the best that you can? And these are some of the stories that we tell people as they are going over there. One of the other things that I would stress to them is, and this is something that I do, is when I come back from a disaster deployment, I let my friends know that I'm okay, and then I ignore everybody for a couple of days. And I do this because I can't always put into words because I'm so high on the adrenaline and doing the best that I can that it's going to take a couple of days for that adrenaline to wear off. And for when I start to go to sleep, to truly remember everything I did, everything I smelled, everything I saw. And it doesn't hit people until a couple of days later. And so a lot of these providers that go over there, oh, it'll be fine. I'm used to this at my trauma center. I appreciate your expertise, but when it hits you, these are some resources that I want you to have because you're going to need them. And there hasn't been somebody that has come back that hasn't needed those resources.
Yeah, because it's I experienced significant stress when I was there, and I felt stress every day. There were times in Kosovo where there were bombs going off, and I didn't know if I was going to be injured or I'd have to take care of someone. And it was a different mindset, just being in a place where, at least here in the U.S., for the most part, I've lived my life not having to worry about it. Jamla, I'm giving a talk to some folks at the University of Chicago in a couple of weeks, honored to give a Grand Rounds talk. And I'm talking about the current and future of my field. And part of my talk is around gun violence and that it affects predominantly the Black population. And I want to just say for a quick second around this that, I have been privileged to live in environments here in the States where I have not had to worry about it. But there are many Americans that are living, and children living in places here in the US where their parents are worried that their children are going to be shot. So while I want to acknowledge that there are places like Kosovo and Gaza and some of the places we've talked about, and many places in the world where there's instability for all populations, there are places in the US where people don't feel safe. And that's really hard. It's and I think about that as a pediatrician and what we could be doing as physicians and healthcare providers, nurses, to actually affect change. It's hard because the work that we do, you mentioned that you do some clinical work in emergency medicine, and emergency medicine. There's so many awesome things that we can do, but there's also it feels that sometimes it's very reactive. In other words, the patient comes in and we're trying to do what we can, but there's no proactive response from the emergency department because we're the safety net. And whereas all of the challenging situations are happening, going on in the community. And I don't know, it's a big nut to crack, but I do think just getting back to what you said, you're very spot on with trying to prepare folks and then also support them when they come back from disaster zones, because from someone who experienced it myself, it took me a good 1 or 2 months to readjust back to the US and almost like reset my nervous system. Does that make sense?
I experience that, and it's hard to put into words to someone else unless they've lived it. I have my routine, as I mentioned, the first few days when I get back, but that doesn't mean that I'm done and I'm over what happened. Sure, I compartmentalize it, but there will be a sound, a smell, something that'll trigger me, and it'll be months until I don't react to that anymore. One thing that I think as responders from the emergency setting and from disaster settings is that we don't advocate enough for public health. And so I say this to you because I'm a firm believer, as you mentioned, that we need to be more proactive rather than reactive. Specifically, you mentioned gun violence. And so what are proactive ways that we can be more involved in the community? And I think that's where public health comes in. And people typically, when they think public health, they just think of, you go to your local clinic, but really public health is this umbrella of so many other things. And I'll just speak from the nursing side. There are many nursing organizations that are very active in regard to gun violence, in regard to community resources. But until we get more people to understand that that is a problem, that parents are afraid to send their kids to school because they are worried that that child is going to call them in tears and that may be the last time they hear from them, until we focus on what's happening here, we're never going to be able to change society or impact, our future generations, because it's happening everywhere else in the world too, just in a different way. So they may not be bombs going off here, as you mentioned, but gun violence is horrific, the number of school shootings. And so this is where being proactive public health measures come in to play, but we just don't focus enough on that. And I think it's because, disasters are sexy, so to speak, when people think that, oh, I'm going to respond to the disaster, and they have this hero mentality. But really, if we're more proactive on the public health side, that disaster wouldn't have been as bad as it was.
Yeah. I actually have, I worked alongside Doctors Without Borders or Médecins Sans Frontières. No, what is the French name for Doctors Without Borders?
Medicine Sans front something. Ugh.
France Sans, but
And I'm
that
fluent in
organ,
French, and I don't even remember.
well, that organization is tremendous. But again, the I have a lot of admiration for you and the work that you're doing to
I
train
appreciate
folks, and I also have a lot of admiration for those people that decide that they want to go and actually support people in disaster zones. I know that there's a little part of me, one of my colleagues named in Kosovo is Dr. Sami Uka, and if you're listening, Sami, um, I want to see you again, my friend, but family physician that I work closely with in Kosovo. And, um, you know, uh, people who work in disaster zones are just very special people. Um, and I believe that some of the things that Sammy taught me and my driver and just experiencing, immersing myself in a difficult situation has made me a better doctor, a human being, dad. Um, but it's hard work. It's hard work.
But it does change you.
It does change you. And the last thing I'll say, you had talked about this man and the dog, and I think one of the things that I've noticed about nurses that they've taught me is it's little things like that. It wasn't a little thing, it was a big thing for that man, but finding ways to comfort um, people and getting them comfortable in an uncomfortable situation, which a disaster is very uncomfortable by almost by default, is a beautiful act of humanity. And I always say that I have a bachelor's like you and an MD and an MPH. Those are all letters, and that doesn't mean anything. But after all of that training, the most important thing I do on a daily basis is bring a child a popsicle and a sticker and make them feel comfortable. And that, my friend, I learned from nurses. And so I think your story coming full circle is that what what happened with that man with the dog, um, bringing a popsicle to a child, volunteering in a disaster zone, what those are beautiful acts of humanity where people are trying to help others. And to me, that's one of the biggest gifts that we can provide as healthcare providers. What are your thoughts about that?
I think the term humanity is what we need to focus on. I think that if we are just kind to one another, and I think that if we do little small acts of kindness, that is going to help us be better humans, be better to each other. And then hopefully, our children and our grandchildren will have a world better than the one that we lived in.
To try to reverse or stop generational trauma.
Amen.
Amen. Well, it was a pleasure to have you on the show. I again continue to be enamored and excited about the journey of human medicine and HUMED, this podcast, because it allows me selfishly to meet awesome people like yourself. I would love to have you back on the show at some point because I think there's so much wisdom that you have, and I think we're just scratching the surface.
Well, I appreciate the opportunity, and I am so grateful to know someone who has such a passion and respect for pediatrics. It is a passion of mine, but also thank you for always advocating for nurses because, we can't do the work that we do without our nurses and our ancillary staff. So thank you, and I look forward to the next conversation.
Thank you, Jamla. So everyone who's listening, please subscribe. We're on YouTube, Spotify, Apple Podcasts, and thank you for listening. And I hope you all have a great day. Bye-bye.
Everyone.